Hi, welcome to this course Issues in Bioethics, Module 4 and Unit 2. In continuation with the previous lecture, where we discussed some challenges posed by some technological advancements in medicine, this unit will also focus on some of them. This unit will focus on the challenges posed by genetic engineering and gene therapy. So, when it comes to genetic engineering and gene therapy or the domain of genetics, we are actually touching upon a very sensitive area, because this is something which tells us about what we have inherited and what our children are going to inherit from us. And we are going to tamper that, or we are going to manipulate, we are going to make changes, modifications in that very crucial information which is hidden in all of us, the domain of genes. And genetic engineering is something which scientists have been practicing very successfully among plants and to some extent animals as well. But their application in the human world is much limited. Of course, people still do that, doctors, physicians still do that, but there are a lot of controversies and ethical issues they raise. And gene therapy also raises several issues, several ethical concerns, and we are going to address some of these issues in this lecture. So, the genes, before we get into the real issues, let's try to have a primary understanding about some of the terms used. The genes in our cells control the chemical reactions in the cell that make it grow and function. In one sense, we can say that the genes are the most important constituents of our organism, and they are very crucial. And when gene therapy is trying to address them, trying to modify them, we are entering into a very new domain of medicine or medical technology. They thus determine our growth and function. The genes determine our growth and function, and we inherit some of these genes from each of our parents. And then parents pass on certain traits to their children. Many of the things, and even some, according to some scientists, many diseases which we have, which we are prone to, are because of the genes which we inherit. There are many important diseases, say for example, certain types of cancers. Certain people are more prone to that because they genetically inherit the kind of gene which is responsible for that. And both gene therapy and genetic engineering involve altering these genetic materials. And gene therapy is it consists of altering genes to correct genetic defects and thus prevent or cure genetic diseases. So, it is a major medical intervention and a very crucial and an important medical intervention which new advances in medicine have introduced. And in that sense, it is going to be definitely a great boon to humanity, no doubt in that. And on the other hand, genetic engineering is to modify the genes to enhance the capabilities of the organism beyond what is normal. Genetic engineering, on the other hand, aims at modifying the genes to enhance the capabilities of the organism beyond what is said to be normal. So, in that sense, the scope of genetic engineering is slightly different and also beyond medicine, we can say, because it tries to even enhance the capabilities of the organism. So, there are certain, these two advancements in modern medicine have definitely introduced certain risk factors. Now, let us try to understand what is the root cause of genetic risk factors, which these two modern therapies or modern therapeutic measures are trying to address. The genetic risk factors, the coding sequences of DNA are transcribed into proteins that control cell reproduction, specialization, maintenance and responses. So, this is what the DNA does. They are transcribed into proteins, the coding sequences are transcribed into proteins which are responsible for various activities that happen to us, and these inherited or acquired biologic factors that result in an error in this molecular information processing can result in fatal consequences. This can contribute to the development of diseases, and this is what genetic therapy or genetic engineering and gene therapy are trying to address. So, predictive testing can tell about the possibility of occurrence of some diseases. For example, Huntington's disease. This is a very famous example that this particular disease is a genetically inherited disease whose appearance can be predicted well in advance if a proper testing is done. And gene therapy aims at trying to find solutions to many such problems. As I mentioned earlier, certain cancers and many other diseases have their roots in the genes, and if we can think of, if we can identify this, we can think of proper measures to prevent them and also to cure them. So, gene therapy. So, let us try to understand what is it. So, here this is a very broad introduction. So, this is trying to not to define gene therapy, but it is also trying to give an account of what gene therapy is by Ruth Chadwick's book, Ruth Chadwick's article Gene Therapy. It says that it is a correction or prevention of disease through the addition and expression of genetic material that reconstitutes or corrects missing or aberrant genetic functions or interferes with disease causing processes. So, this account is trying to give a comprehensive picture about what gene therapy is. And several methods are used to spread the genetic change in all the cells, because for instance, it is very difficult to change all the cells, taking them one by one. Scientists cannot do that. So, what they normally do is that they use a carrier, a vector, which is a molecule or an organism such as a virus to deliver a therapeutic gene to the appropriate target cell. See, for example, if there are certain cells which are cancer cells which we are trying to modify, we are planning to modify, we are trying to make some changes in those areas. Say for example, in the liver or in the heart, for example, certain other problems in the heart we are trying to make certain changes. So, these changes have to be made only in that particular organ, not anywhere else. So, what doctors do is that they inject the virus with the genetic material which then reproduces and infects the target cells, and then do the needful, the desirable. So, this is how gene therapy is normally done, or rather the idea of gene therapy. Now, there are several advantages of adopting gene therapy. It has the potential to cure some diseases or disorders which conventional therapies cannot do, and scientists expect that in future, once gene therapy advances more and more than what it is today, we would be able to resolve many problems with the help of gene therapy. And gene therapy is expected to have less side effects than consuming medicines, drugs which are chemicals, because many drugs, some of the problems which drugs have is that though they might be very effective for the kind of diseases for which we consume them, but most of the drugs will have side effects. So, often what happens is that patients will have to choose between bad and worse. Worse is the disease and bad is the side effects which are due to consuming the medicine for the disease. But these things can be avoided if you can identify the problem area and target it with the help of gene therapy. You can probably resolve the problem without taking drugs. It can prevent diseases in those whose genes have predisposed them to those problems. So, you can identify which gene could cause certain diseases in future and tackle them and try to solve the problem much in advance, much before the disease actually manifests itself. So, gene therapy on reproductive cells, which is another area which we are going to discuss. There are two types of gene therapies which we will be discussing very shortly, but the gene therapy on reproductive cells can keep children from carrying such genes for genetic diseases and disorders they got from their parents. See, for example, Down syndrome is a major problem which children face. So, this is another genetic disorder, very serious genetic disorder which can be identified much in advance, and parents can resolve this problem by effective gene therapy on reproductive cells. Genetic text can reveal the presence of certain genes which might cause certain illnesses or disorders in people well in advance. So, this is the advantage of gene therapy, genetic texting. If you conduct genetic testing, genetic test can reveal the presence of certain genes which might cause certain illnesses or disorders in people well in advance. Any of the symptoms of the disease are visible. The symptoms are visible much before the patient, the so-called patient much before the so-called patient starts having troubles from the disease. The presence of the disease can be identified and physicians can start treatment for that. And this enables diagnosis before symptoms. That is the greatest advantage of this new technologies. For that we have to of course have genetic scanning or genetic text, for which we have facilities today, or we may need more and more facilities for tomorrow's generation. Genetic engineering can be used for enhancement, better offspring with better intelligence and skills and better future. So, this is another very interesting and very controversial possibility of genetic engineering, that it can think of having better offsprings. The whole idea of better offspring is very extremely controversial. What do you mean by better? So, these are issues which we naturally have to grapple with. We will discuss it slightly later. And enhances our reproductive freedom. No doubt in that. The reproductive freedom and autonomy are increased. It enhanced with these new technologies, because these new technologies provide us new possibilities which we can think of and employ. Now, when we talk about genetic alteration and therapy, there are certain methods used by scientists all over the world. For example, there is something called homologous replacement, where a DNA in the gene could replace by other DNA from outside. Another method is selective reverse mutation, where we force the gene to mutate and change its structure. The third one is adding, where you add a new gene. The fourth one is turn off a gene by using a chemical to prevent a particular gene from getting activated or functioning. So, these are the common methods, and many other a few other methods also people are trying now. So, these are some of the important methods scientists use for genetic alteration and therapy. And the types of therapies are, we can generally classify that there are two types of therapies, somatic and germline therapies. Somatic is a therapy which targets body cells, and germline therapies are therapies which target the genes in the reproductive cells. Therapy and enhancement, these are two possibilities. On the one hand, these new technologies aim at solving problems. Their use is directly therapeutic, but on the other hand, there is also the possibility of enhancement. And therapy is a treatment of diseases, as all of us know, and enhancement is to go beyond therapy and introduce improvement in some respect. So, this is what I mentioned. When you talk about improvement, what do you mean by improvement? Improvement in intelligence, in height, in complexion, these are all controversial issues. And now, since I mentioned about the two types of cells, the somatic cells which I said are the body cells, and the reproductive cells, let us have a little more detailed explanation of these two. Somatic cells are, most of the cells in our bodies are somatic cells, like our skin, our heart, liver, all these cells are somatic cells, skin, liver, heart, lungs, etc. And then changing the genetic material in these cells is not passed along to the person's offspring. So, whatever treatment a person undertakes will be confined to that particular person. This will not be passed on to the next generation, because that is basically done at the body level. But on the other hand, reproductive cells are these sperm cells, egg cells, and cells from very early embryos. So, these cells are the parent's egg, and sperm cells are changed, and the inserted gene may pass on to the future generation. So, whatever modifications, therapeutic interventions we are trying to do here will have an impact on future generations as well. So, that is what makes the germline therapies or the reproductive cells therapy a little bit more crucial and more vulnerable or more prone for ethical issues or violations. So, one of the advantages of this therapy is, of course, we can avoid the birth of children with deformities and other major inherited diseases. On the other hand, there are certain interesting ethical issues which it would raise, because we are already proposing and executing treatment for people who are yet to be born. So, without their consent, can we do that? These are some of the issues. So, changes in their genetic makeup would be passed along the person's offspring and impact on the gene pool of the species. So, that is what makes this reproductive cell therapy or germline therapy more serious. Now, when we concentrate on risk as far as the somatic therapy is concerned, the cells introduced into the body via a virus, which I have already mentioned, a vector is needed, and quite often a virus is injected with the gene. And this virus, there is a possibility that this virus could recombine with other viruses and infect the germ cells. So, there is a possibility that it might not do the desired consequences, or it might bring more than what is desired, sometimes even adverse consequences, sometimes even unexpected adverse consequences. So, in that way there are certain uncertainties which are yet to be solved. Again, vector may deliver the DNA to cells other than the target cells. This is again a serious problem, because we, of course, as I mentioned some time back, taking the example of heart or liver, the target cells are in the heart, and we are trying to, what we desire is that the required changes have to be made by gene therapy in the heart, and we inject it through a virus, but it may deliver the DNA to cells other than the heart and many other places, which might bring us very undesirable and unexpected consequences. And this might also have certain indirect changes. This might also affect some indirect changes in the gene pool, though directly it may not do that, and lot of uncertainties, no doubt in that. And when you come to the germline or reproductive cells therapy, it will affect the future generations who have not consented to it. This is what I mentioned, that we are in effect, interestingly, we are proposing or we are executing a treatment for people who are yet to be born, to the next generation. And one of the fundamental principles of medical ethics is that we have to take consent before we actually execute a treatment, but we are not doing it here. But this is again not a very valid kind of an argument we can point out, because in the case of our children, when we take decisions, medical decisions, on most occasions what happens is that it is the parents who take decisions for the children, because children we believe are not mature enough to consent for medical therapeutic intervention. So, parents take the decision. Here also the parents are taking the decision. So, there is not much of a significant difference from parents taking decisions for infants and in this case when you take decisions for the future generations. Now, again, questions raised by the idea of reproductive autonomy and freedom, decisions about what kind of children to have. So, this is another possibility of germline therapy, gene therapy, because we have a lot of reproductive autonomy and freedom with this new technology, because we can decide, we can know whether children are going to have any genetic disorders. If there are any serious genetic disorders, parents can opt for abortion or even treatment in advance. Certain diseases can be treated well in advance, and this could be done. So, that possibility is there because of the new technology. And again, can we allow people to choose have children who do suffer from a genetic disorder? This is a very interesting, serious concern, but at the same time a possible concern, because it is quite possible that some of the parents, say for example, both the parents are deaf, and they might desire their offspring also to be deaf. This is not a very common phenomenon, but this is not impossible. Sometimes parents may desire so. So, they are opting for a deaf child, which is in one sense we can say consciously making the child deaf, a disability. So, can we allow this to happen? If you are talking about reproductive autonomy and reproductive freedom, then you will have to allow this as well. So, these are some of the contradictions involved in the issue. This therapy is at the moment extremely uncertain. The consequences are uncertain. There are a lot of uncertainties. So, failure in the treatment is possible, and the gene failing to be introduced to be activated, the resulting child may suffer more than otherwise. So, that possibility is also there. So, these are some of the factors. Again, errors in gene insertion may be severe and might affect generations, because germline gene therapy or reproductive cells therapy will have a bearing upon the next generations and also the gene pool, changing future generations, and not just one individual is involved in this case. So, in that case we have to approach germline gene therapy with extreme caution, and we have to be extremely careful here. Now, there are certain general concerns, because since I have been talking about desirable consequences, improvements, and many other words I have used here. So, there are some very general concerns which are applicable for all kinds of genetic interventions. The question is, who decides what is good and what is bad use of gene therapy? Because we are talking about we have given the example of that deaf parents wishing to have a deaf child, or parents coming to know about the kind of disability of their child and decide to abort the child. So, all these are very crucial decisions which parents take for the next generation, for the immediate offspring, and on certain occasions for the coming generation in total. So, who decide? Who has the right to decide this? On what basis you know that certain decisions are good and certain decisions are bad? Who decides which traits are normal and what is a disability or disorder? There are a lot of disagreements on this. Again, the whole idea of normal is an extremely controversial notion. What is normal is yet to be decided. Gene therapy is going to be expensive and will favor only the wealthy. This is another serious problem which our world is going to face with with the gene therapy becoming more and more popular, because it is definitely going to be more expensive than conventional therapies. And gene therapy enable us to design new generation on the basis of our aesthetic prejudices, which are products of domination and hegemony. So, sometime back I mentioned this is particularly more relevant when it comes to genetic engineering, where we can literally design babies, decide what are the features the future generation is going to have. So, when you decide this, on most occasions what happens is that we are prejudiced by our aesthetic sensibilities, which may not be a very politically right or ethically right, because we are quite often influenced by certain forms of domination and hegemony. See, for example, many people think that it is good to have white skin, white complexion, which is actually for which there is no basis. It's a prejudice, but unfortunately because of certain historical, cultural and social factors, this is the way many people think. So, this is a clear discrimination against people who have dark skin. A huge majority of people who have dark skin in the world are being there is a possibility that such people will be looked upon by prejudices. So, in that sense, these new technological possibilities are probably, we can argue, encouraging such prejudices to spread and people practicing them in their own lives. Now, I mentioned that genetic engineering is one possibility where enhancement is one of the direct concerns, and this happens in the case of plants, and plants this is being used. In the case of plants, this is being used by scientists quite successively, and also in agriculture genetic engineering is used to prevent certain very important problems, like with new genetic engineering technologies, scientists could bring down the usage of pesticides and other things. They can develop pest resistant varieties, they can develop pest resistant weeds which will yield more than the conventional ones. But when you apply them in the human world, it definitely invites a lot of problem. Our knowledge in this area is limited, and there may be unforeseen dangerous consequences when you try to apply this in the case of man. Again, here the attempt is not to attain normalcy, but to better and go beyond. See, on the one hand, normalcy itself is a very controversial notion. What do you mean by normal? But here the idea is that genetic engineering technologies are used to go beyond that, to go beyond what is normal. And it is in that sense we can say that against natural order, and many theologians and religious people criticize the application of genetic technologies precisely on the ground of precisely on this ground, that it tries to go against the natural order which is created by God according to them. Whether it is created by God or not, there is a natural order, and genetic engineering is a forceful intervention in that natural order, there is no doubt about that. It is in one sense people argue that there are certain people who argue that it alters the process of natural evolution. Everything in this world is evolving, that is a scientific view, but there is a course of natural evolution, and with the introduction of genetic engineering technologies, you are making forceful changes, which is some sort of a revolutionary change, which have happened not as a result of natural changes, not as a result of a response to what is happening to the natural environment, but something which scientists have decided to bring about, and they brought it about with the use of technologies. So, in that way we can say that it is absolutely artificial, may even create non-human alienated creatures, problems of human identity. See, there is another very important problem which ethicists imagine here. People who have been born out of usage of these technologies, of course, with so called improved qualities and characteristic features. The problem is that since they have born out of non-natural methods, they constitute a kind of species within the human kind. Within the human species, they constitute another species, a special species with very different characteristic features. So, they might alienate themselves with their features as a result of their so called improved features. This might cause very severe problems of human identity and alienation, and no limit to enhancement. That is another problem. Enhance the capabilities. What is your limit? Of course, we all know that many of our capacities and qualities have certain limits, but when there is a possibility of improving them, what is our limit? So, those who are enhanced may become obsolete like computers. This is another problem. It is a fact that we all enhance our computers to, when the new operating system comes in the market, we enhance our computer and its performance goes up. So, the older one will become obsolete. The telephones, the mobile phones which we have used 5 years back have become completely obsolete now. We are now after new models of mobile phones. Now, it is smartphone. Tomorrow, there will be another model. So, every day there is an improvement, and these people who have born out of genetic engineering with improved characteristic features will repeatedly get obsolete with the new addition of improvements in the next generation. So, they will become like smartphones and computers, their identities, not like human beings. It is a version of eugenics, brand some people as undesirable, question concerning value of life. So, this actually had genetic engineering, and the whole idea of enhancement can create is the eugenics, the possibility of eugenics. And we have seen the historical version, we have seen in human history the ways in which can be really undesirable. So, it reminds us, the idea of eugenics actually reminds us the Nazi Germany, where certain people were treated as worse than animals, not as human beings. And again, people who are unable to produce, people whose productivity is, people without productivity like old people and all that. So, they were all treated inhumanly under the Nazi regime. So, here also there is a possibility that we might brand some people as undesirable, which raises very serious concerns about the values of life. Now, when you talk about the genetic test, again, diagnosis before symptoms is one of the attractive features of the genetic test, which I have mentioned some time back. This can be really counterproductive, because it particularly in those genetic disorders where treatments are not available, as this may make patient more anxious and affect their normal course of living. Psychological harm, great psychological harm will be done under such circumstances, and social discrimination could happen to such kind of people. This is another problem, because on many occasions what happens is that the genetic testing is available, scanning is available, but you identify a problem, a serious medical problem for which you have no medicine, and patients have to be told about, they have the right. So, truth telling, disclosure, that is a major, that is one of the primary obligations from the part of the physician. So, now the patients have all information about their diseases for which there are no medicines available. This might cause severe psychological harm to the patients. And the predictive or risk assessment nature of genetic information may go against the interest of the individual, in the sense that this information might land, this might go to the hands of the insurers. Insurance companies might refuse to insure the individuals, because they come to know that this person is prone to certain very severe diseases. Then again, employees might know that this person is going to have such a disease, so they decide not to hire him. So, there are several such issues which might affect the confidentiality issues, privacy issues, which might raise very serious issues with the relation with confidentiality and privacy. In spite of all such worries, all such inhibitions and concerns, genetic testing and genetic engineering, and of course, gene therapy, they are all new possibilities which can actually bring a lot of benefit to the entire humanity, no doubt in that. We should know how to use them, we should have the right policy how to use them. So, if the technology is available, we should not deny it to potential beneficiaries. We have no right to do that. It is a knowledge, scientific knowledge, which is available with humanity, and humanity has the right to benefit out of this. We should not deny patients their right to know and take informed decisions about their health and treatment. So, here what happens is that one of the greatest advantages is, if you know in advance about a particular disorder, this which may pass into the next generation, we can take advanced decisions, actions to prevent this from happening, which in one way will be a great help for the next generation, for our children. So, in one sense this is going to be a great boon for all of us, and in certain other cases they may prepare advanced directives about the management of these diseases. You can plan well in advance if you know that you are likely to have a particular disease, what to do by that time. And this actually, the problem here is not the problem with scientific knowledge or technological know-how. The problem is with humanity's management of this knowledge and technologies. Humanity has always mismanaged it, has always mismanaged science and technology, and naturally this might happen in the world of medicine as well. But that does not mean that we should not use technology at all. We should not progress technologically and scientifically. We should use them with caution and with ethics. So, this actually reminds us the original division between science and ethics, ethics and technology, ethics and science. So, the problem is, the challenge, the real challenge is to use science and technology for the good of humanity. And once we do that, many of these great technological advancements can make human life better and better in this world. I will conclude this lecture at this point. Thank you.